Thank you, Mr. President. I'd like to address the Senate floor on what our activities are for the week, and that is our Obamacare repeal. When I was thinking about what I was going to say today, I went back and looked at a speech that I made on the House of Representatives floor on March 21st, 2010. And the previous speaker talked about the partisanship that she perceives now. And I thought it's interesting. I'm going to read just a couple quotes from my speech then. And we're thinking about this bill as a blanket. This is a quote from me, the Obamacare blanket, a blanket of health care legislation that may be draped across America and its population in the coming years, which it has for the last 4 years. But I talk about how its cloth has been cut behind closed doors and its color is tinged by partisan hands. That's the Obamacare legislation and the Obamacare plan that we have today. Its huge holes will not protect the cold winds of job loss, new taxes, government bureaucracy, and increased health care costs. All of America will feel the weight of this uncomfortable burden. Those were my words in March 21st, 2010, on the House of Representatives. Today, later this week, the Senate will consider a bill to repeal that bill, Obamacare, a costly disaster that 5 years later, we see has cost countless people access to their doctor, access to their health care plan of their choice, and the thousands of West Virginians from my state who have lost or had to change their coverage. We ought to ask individuals and families whose premiums and deductibles have skyrocketed, and the small businesses who have been forced to cut hours and employees. Let's consider the exchanges that are folding, and the hospitals that are facing unmanageable costs. Even the nation's largest health insurance provider has threatened to pull out of Obamacare, citing high costs and growing risks. Just today, the CEO of that company said that joining Obamacare was, quote, a bad decision. There has to be a better way, and we need to find it. The bill that we are considering this week, the Senate will do two major things. It will repeal significant portions of the health care law that are not working. It will also provide a bridge to replace this law with an improved health care system. This Obamacare repeal bill would eliminate enforcement for the individual and employer mandates. It would repeal $1 trillion in onerous taxes. It will save and strengthen Medicare. And it also will dedicate resources to fight the growing drug epidemic that is sweeping across this country. Certainly in our state of West Virginia, we've had many difficulties, as many of our fellow Americans have. Obamacare has upended our health care system and has broken many of the president's own promises. Headline after headline in recent weeks has called attention to the increasing premiums Americans will face next year. Across the nation, rates for 1 out of every 3 Obamacare plans will double in the year 2016. For the plans that are not seeing huge premium increases, rising deductibles are placing an excessive burden on patients. But not just on patients. Let's think about our health providers, our hospitals, for example. When a patient has a high deductible and comes in for an expensive surgery, that patient then has to pay the $4,000 or $5,000 deductible. It's unaffordable for a lot of people, and that hospital is stuck with that bill. The situation in my state is even worse. West Virginia is the only state in the country, with only one insurer that is participating on the exchange. Remember, the president promised us choice and the ability to make decisions for ourselves. We have one choice in West Virginia. Highmark Blue Cross Blue Shield has been the only company in the West Virginia exchange through the first 2 years of Obamacare. And we recently learned that it almost pulled out of the exchange in 2016. That would have been disastrous for our constituents. And why are they pulling out? Because they're losing millions and millions of dollars of a health care plan that was promised to be a blanket, to blanket all of us, as the speech I gave in 2010, but really turned in to be the blanket with huge holes. With only one provider, choices and accesses are already limited. But for many Americans, the exchanges set up under Obamacare have become their only option. Because of increasing costs, many are now unable to afford the health insurance without subsidies. While Highmark Blue Cross Blue Shield, the exchange insurance in West Virginia, did remain in West Virginia, Premiums are set to increase this year or next year by 24%. These increases are well beyond the financial reach of most West Virginians. Our unemployment in West Virginia has skyrocketed because of the president's energy policies. And now we're looking at hardworking West Virginians and telling them their health care that was supposed to be affordable and accessible is going up 24%. That's unconscionable. As one of my constituents pointed out, quote, "This represents a significant challenge to our family budget, as my husband's pay has not increased at the rate that our health care costs have continued to rise." What about Obamacare's promise to lower the cost of health care? The reality is really quite different. As another West Virginia put it, and I quote, "The law remains a failure by the administration's own metrics, and its harmful impacts continue to make life more difficult for millions across the country," end quote. By repealing Obamacare, we can revisit the problems caused by the health care law and the problems that existed before, replace them with reforms that work, and protect those whose coverage has been disrupted. In order to ensure individuals do not lose access to current coverage, this Obamacare repeal bill will provide a 2-year transition period. This period will give us time to enact alternative reforms that will provide access to quality, affordable care without disrupting coverage. Healthcare reform should give states and individuals choice. Remember, my state, we don't have a choice. We've got one provider, no choice. While reducing healthcare costs over the long term, premiums going up 24%, deductibles skyrocketing. That's not containing costs over the long term. Americans deserve a health care system that works for them. And we know that Obamacare is not it. There is a better way. I yield the floor, Mr. President.